Hello, Cody High School students. We're here from the School of Nursing at University of Michigan. In the past, we've been able to give you an in-person tour of the school, but to accommodate for the changing times, we've put together a virtual tour. We know that getting exposure to healthcare professions can be difficult, especially during times like this. We wanted to share what the School of Nursing is like, what kind of facilities we have, and how they've enhanced our learning experience. We've included some video interviews from faculty and students on their experiences with nursing as well. This is the first floor of the School of Nursing. This is an area that the school often uses to host events or for students to meet and study before or after class together here. There are a few vending machines with food and drinks if you need to grab a quick snack, and a microwave to heat up food you may have brought. The first floor has 3 lecture spaces for instruction or events to take place in as well. Next, we'll walk up to the second floor. The School of Nursing also has an elevator that goes from the basement floor through the first, second, third, and fourth floor, so students can pick how they get to each floor. This is the second floor lounge area. Similar to the first floor, this is a study space for individual work or to collaborate with peers. There are also classrooms that are commonly used for lectures, and sometimes for events hosted by the school. Let's take a look at one of the classrooms. This is one of the larger classrooms in the School of Nursing. It's used for our first year and second year students who have larger lectures. Next, we'll take a look at one of our second classrooms on the second floor. This classroom is a smaller classroom. It's used to promote group work between our third year and fourth year students. It has small pods where students can share ideas and work together on group projects. Next, we'll go to the third floor. This is the third floor. On the third floor, we have rooms for groups or individuals to study or review for exams or quizzes. We also have administrative offices and resources on the third floor and the fourth floor.
We are now moving down to the basement of the nursing building where the Clinical Learning Center, or CLC, is located. This is the lounge in the CLC where students can come to study or work on projects together. There are a few computers, printers, a microwave, and fridge for students to use as they need while in this space. This is our simulation suite. This room has high-level mannequins which help to create the feeling of interacting with real-life patients. We have a child, adult, and pregnant mannequin. In the simulation center, we also have an automatic external defibrillator and a crash cart and medication dispensing systems like they do in the hospital. The access to the equipment helps to simulate a hospital environment and prepare the student for a multitude of hospital situations. There are many posters such as this one around the school that help to motivate students with their learning. Now we would like to move over to the interviews we have done with faculty and students here at Michigan. We want to share their experiences for you to get a better understanding of what being a Michigan nurse would be like.
Back when I was in high school, I do know that it came from a genuine need to want to help people. I found, a lot of satisfaction in that, and I searched for a career where I felt that I could somehow give something of myself to help people.
Nursing was like one of those ideal careers where you could nurse as a professional, and because of the high flexibility, people liked it because it allowed for more full-time ministry. I've never been unemployed. It's been super flexible with my changing life over the years, because it's a 24-hour, 7-day a week, 365 days a year type of a job.
I was looking at various options, and I really like nursing because there's a lot of opportunities to change. So you can be a cardiac nurse, you can be a psychiatric nurse, you can be a home health nurse, you can be in community, you can do pretty much anything in nursing. And I really liked that I could just take my career wherever I wanted and I wasn't stuck in one field. So that's why nursing was something that really stood out to me.
So University of Michigan is like one of the top 10 nursing schools in the US. And just like the campus life is great, both academically and socially. And I think what makes it unique is like all the resources that they offer, the scholarships, the language resources, like they really try to accommodate for their students.
University of Michigan is my home, and so it is in the top 10 for nursing schools. We are surrounded by hospitals that rank in the top 10. The university itself, just about every program is in the top 10, whether it's engineering, whether it's medicine, both undergrad and graduate programs, law school, policy, social work is number one, public health, and master's and undergrad number 1 and 2, or they're in the top 5 at least. And I wanted to be an environment that created or cultivated leaders. And essentially I wanted to leave, but my home was here. And what better way to be in a place that fosters the leaders and the best. And that's how I feel in every area that I practice and teach and do my research in nursing is that with the University of Michigan.
I chose Michigan because it's honestly like one of the best nursing schools, if not the best, for undergraduate programs, at least for me. There's amazing schools everywhere, but University of Michigan is truly an amazing program. It has an amazing nursing school with the faculty is wonderful and great resources as well with sim labs and everything. It's just a really great program. And also I'm a low income student and I was able to get some pretty good aid from the university. We're just starting our clinicals next semester and we're doing introductory clinicals this semester. So that means we're in the sim labs where they have they're like high fidelity mannequins where depending on what skill you're practicing, they have like veins that you can put an IV into. They have genitalia for catheters, or you can put nasogastric tubes in through the nose. So basically we're starting out on mannequins so that we can practice the skills and make the mistakes that we might have to make to learn before we're doing it on a real patient.
So clinical day is my favorite day. It's not like you're just sitting in class taking notes and listening to lecture. You're actually doing a lot of hands-on practice and seeing what it's like to really be a nurse, which is exciting and always fun.
In terms of the clinical experience at Michigan, has been really great for me because we have Michigan Medicine, which is one of the best hospitals in the state. I think it might be the number one in the state. And I think it's definitely one of the top hospitals in the country. And I think there's pretty much every single resource you can think of that Michigan Medicine has. And a typical clinical day for me is really exciting. I'm currently in the emergency department at Michigan Medicine, and every day is completely different. I don't know what I'm going to walk into. There's so many learning opportunities. There's so many things that I get to do, I get to be a part of, and working with a staff that loves what they do and loves to teach is something that I can only dream of. So I'm really happy with the clinical experience at Michigan.
When I'm making decisions about where to attend school, whether it's for undergrad or for graduate, really go somewhere where they are interested in you as a person and interested in investing in you. So nursing is a rigorous degree. And so I think it's important to lay a good foundation. And so to make sure that your grades are excellent, particularly in math and science, I think it's really important. I also think it's important to show that you're a balanced student. And so, like I just talked about, the way that I showed balance was between being a leader on my basketball team, as well as being in the National Honor Society. So I think it's important to show that you're able to balance different activities.
I think I'd probably give all of you the same advice that I gave my own children who are both in college now, is explore. Explore what makes you happy. Explore in terms of try to find opportunities to observe or partner with somebody in a specialty that you like. If it's nursing, if that's where you're finding your passion, then seek opportunities to shadow people that might be in the profession or near that. Even contacting your own primary care doctor or clinic or something along those lines to have an observational time where you can kind of see nursing in action and see if that is a fit for you.
There's so many ways of entering nursing as well. If your grades aren't fantastic and you need to do a little work, You can still be a nurse. You might have to go to the community college first and maybe take some prerequisite courses, which are some of like the preliminary classes that you need to demonstrate that you can do excellent work. And like maybe you was just not in a great environment that allowed you to focus, or maybe you was just being immature. So you could go to community college, take some preliminary classes, and then transfer. We have transfer students. So even if like you don't meet the criteria to come to U of M, right away, like maybe your grade point average is just way too low, go to community college, go take some preliminary classes, and then come in your sophomore year as a transfer student.
I would say that it's important to have time management skills, knowing how to balance your social life and your academics, having dedication, because it takes a lot of work. This is not something that you can just get by. There's a lot of sacrifices that have to be made in order to achieve and be successful in terms of the School of Nursing here and being a nursing student. There's a lot that comes with it, but if you take that time and you do the best that you can and you're dedicated, you'll be successful and you will make it to the end.
If this is a profession that you are interested in, we encourage you to go to your high school career counselor and find resources to help you through this journey. There are many different avenues that you can take to attend nursing school. You can apply for direct admission into a 4-year nursing program, or you could also attend community college for 2 years and transfer into a program with the proper prerequisites. No matter what avenue you decide to take, you should talk to someone to find opportunities and resources available to you.